Welcome back to the latest episode of Taking Charge of My Cancer podcast. And I have such an amazing guest today. This is Erin Mook. She's a dedicated professional with a robust career in internal auditing since 2010. Over the past 15 years, she was honed her expertise in evaluating and enhancing organizational processes, ensuring compliance, and identify areas for operational improvement. She's a certified internal auditor, certified inspector general auditor, and a certified in the government of enterprise information technology. She holds a Bachelor of Arts degree in journalism from the University of West Florida. Beyond her professional achievement, she's been married of her high school sweetheart for 14 years and is a devoted mother to three children, aged 8, 3, and 9 months, balancing the demands of her career with the joys and responsibilities of family time. On April 1st, 2024, she was diagnosed with breast cancer invasive ductal carcinoma stage 3. At the time of diagnosis, Erin was 17 weeks pregnant with her third child. Navigating a cancer diagnosis while pregnant was terrifying and challenging to say the very least. Erin went through chemotherapy while pregnant and had a single mastectomy with a lymphovenous bypass surgery 6 weeks after delivering her baby. 4 weeks after surgery, she went through 30 rounds of radiation therapy. Outside of work, she enjoys gardening, cooking, exercising, and spending as much time as possible at the beach and with her family. So, Erin, thank you so much for doing this with me. I really appreciate it.
Thank you for inviting me. I'm honored to be here and to share my story.
Excellent. So, if you can take us back to the moment when you were first diagnosed with breast cancer.
Yes, it was April 1st, 2014, the worst April Fool's Day
Oh my goodness.
ever.
I didn't even realize that was April Fool's Day.
Yes, jokingly will say that's the worst April Fool's joke. But it was not a joke. It was real. And it was almost like an out of body experience. I remember the doctor telling me, it came back, your pathology came back from your biopsy and it's cancer. And I was not prepared for that at all. I had been thinking the whole time that it was nothing and it wasn't. So that moment was just extremely terrifying. It was almost slow motion, like this is real, this is happening. These words that she's saying to me, she's saying cancer, she's saying it's positive. And so it was extremely terrifying
How did
to hear that.
how did you find out? Did you have you palpate a lump or what happened?
I did. So in June of 2023, so almost a year prior to diagnosis, I felt a lump in the shower and I knew that something was not right immediately. I had that gut feeling like this is not right. So I called my doctor and mammogram and ultrasound later, it comes back and the words on on the report were in unremarkable. So I'd never had a mammogram before. I'd never had an ultrasound before. There was nothing to compare it to.
Mhm.
And the doctors reading the report were saying, yeah, there's nothing here. We will follow up in 6 months. And at the time I thought perfect because I didn't want it to be anything, and it went on and lived my life, busy mom, working, taking care of kids. That fall, I felt sort of like a puffy spot underneath my arm. Again, kind of ignored it. And by the time it was January, which was 6 months due for my follow up, I just didn't feel right. I felt off. I had a lot of brain fog. I had some other things happening that were just not normal. And I wasn't sure if this is just, I just turned 40. Is this 40? Is this what 40 feels like? But I knew it was time
Maybe.
for, yeah, maybe. I knew it was time for my repeat mammogram. So I go in to talk to my doctor about all this. And I'm waiting for the call to get the repeat mammogram and ultrasound. And on a whim, I took a pregnancy test, just thinking to rule it out. And it came back positive. And I thought, this must be why I feel so weird, is because I'm pregnant. And so I was a little bit nervous then finding out I was pregnant. We had tried for years to have children, my husband and I, and it took a lot to have our other two kids. And so to find out that at 40 I was pregnant was just crazy. And so all of the, the mammogram and the ultrasound, I kind of put that aside because I thought I've got other things to take care of here. And it wasn't until March I was visiting with my OB. I had noticed some skin changes that I thought might be some type of mastitis. And I my OB was wonderful. And she looked me in the eyes and she said, "This is not mastitis. This is not normal. We need to have another ultrasound." And I'm so grateful to her for saying that because I probably would have just carried on
Yeah.
with everything else. And so another, ultrasound later and biopsy led us to April 1st to that diagnosis. So that's how that all came about.
Oh, wow. Wow. So you're pregnant here, you received the diagnosis. What were your immediate concerns that the medical team had for you and the baby at that point?
Immediately, we were trying to stage um, my cancer. So we knew but from the biopsy that I had lymph node involvement, which automatically put me to stage 3. And so we were trying to go through some non-invasive testing to see if it had spread to any other vital organs. So I did an ultrasound of liver and kidneys and some other areas to try to assess, but we really couldn't do the the PET scan and some of the other better imaging we couldn't do because of the pregnancy. So that was the big concern was where do we go from here to make sure that they stage me appropriately to figure out what the treatment path would be. And then, there wasn't really a risk that the baby would be affected by the cancer. It was more, let's make sure that we pick the correct treatment path so that the side effects of the medication, that would be what would impact the baby. So all of that had to be taken into consideration. Um, it was, you learn a lot very quickly with the cancer diagnosis. I'll admit I was pretty naive. I had some friends and family members who had gone through a cancer diagnosis, but a lot of the terminology wasn't familiar with medications and that whole procedure. So you had to learn a lot very fast because you have to make decisions very quickly in order to, go ahead and get treatment. That was one of the things that was really impressed upon me from the medical team was we need to start treatment now.
Oh, wow.
And um, because not knowing how advanced it was, we needed to do something now to try to, and basically what we were doing was buying time. We were buying time until the baby could be born. At the time, I was 17 weeks pregnant when I got the diagnosis. So we were kind of calculating, okay, what can we do in the next few weeks to get us to as close to full term as possible so we can deliver baby and then, do the aggressive cancer treatments.
So what type of treatments did they offer to you?
So it was not recommended for me to do surgery right away. I think had I not been pregnant, that might have been on the table, but my doctor advised not to go with surgery first, that we should do chemotherapy first because the surgery would have put too much. It would have been too much on my body, is what the recommendation was for me. Um, Chemotherapy is actually an option if you are past the first trimester.
Which you
You can
were.
do chemotherapy, yes, in second and third trimester. So I was past the first trimester. We could do chemo, and so that was what we decided to do. We were going to do 4 rounds of the AC chemo, um, adriamycin, cytoxin, and then I was recommended to do another 16 rounds of Taxol. That was the original plan. We were going to see how far we got in that and see. It was sort of like week by week we assessed. We had this sort of loose outline. We're going to do chemotherapy for this amount of time. At some point we wouldn't be able to fulfill that whole treatment plan because baby would be born, and so we weren't quite sure at the time that we were staging all this out, when that would be. But it was chemo, birth. Then we would reassess. We would do a PET scan and do some of that other scanning that we couldn't do while I was pregnant, and then, decide on treatment from there. So that was what we decided.
Wow. Was any concerns? Because we know that adramycin is a heart toxic drug. Were there any concerns about the baby heart with the medication? Or what will you tell us a little bit what you learned about, chemotherapy and pregnancy? I think I mentioned that to you when we met, and we met as you came as my patient prior to surgery. And we talk about how this kind of like for years I thought that wasn't an option, right? You're pregnant, you could not do chemotherapy. And then I was really surprised years away, or a few years back, when we have somebody, gynecologist obstetrician, came to a tumor board and explained to us a little bit about the role of chemotherapy during pregnancy. I was very surprised by it, because I thought it was absolutely a no-no for the baby. So you want to tell us a little bit about like what you learn about
Sure.
chemotherapy and the safetiness, and is any of that will like involve put in, like in danger the baby's heart, or how that works?
Yes, absolutely. Like you, I didn't know that chemotherapy was an option. But it is into the second trimester. It is, and some of the medications, so the different chemos carry different risks, and the risk to the AC combo that I was on, also, I guess like this, the people call it the red devil,
Mhm.
um, is heart issues, and not just right now while you're on chemotherapy, but long term it can cause issues. They can just pop up later on in life. And so that was a major concern. I shared all of this with my high risk OB. So, along with my regular OB, we were seeing a high risk specialist at maternal fetal medicine, who had seen some cases before of women who had breast cancer and were pregnant. And so she came up with a monitoring plan for the baby, while my oncologist came up with a monitoring plan for me.
Mhm.
And like I said, it was very much week to week for both of us. How are you? How is baby? There were lots of scans to check that he was developing normally. So by the second trimester, the brain and the major organs are already developed. So it's not so much of a risk there, developmentally wise. The risk is um, early delivery, or something that could cause me to go into labor too early. And then also low birth rate or low birth weight,
Mhm.
which could also be, caused from going into labor early. So all of that, the monitoring plan was key for me and for baby, to make sure that any symptoms I had, I kept a log. I talked those over with my oncologist and the nursing team there, to just make sure that any little thing that was happening, that it was whatever it was affecting me, to see if it was affecting him as well. And then now, um, yearly, he will have checkups with a heart specialist,
Oh, wow.
for at least the first 5 years,
Oh, wow.
that we,
That's
yeah,
great.
so we, yeah.
Wow, that's great. I did not realize, but that. And so then everything went well, and everything was modified and delayed surgery wise, right? So then you delivered the baby, and that was a beautiful baby boy, right?
Yes. So the goal was to make it to 32 weeks. So we made it to 32. And then the next goal was 36. We made it to 36. And then by then we said, okay, schedule C-section, which took a lot of pressure off of me and my husband too. We were all under a lot of stress anyway. And so, as much as I would have loved to have a natural birth, it wasn't really in the cards. And looking back now, I think, okay, that was just a blessing in disguise, that, that was planned. And so at 38 weeks, yes, we had a healthy baby boy. And I am just every day thankful for that we made it that far. He was 7 pounds, 5 ounces.
No low weight bird at all.
No, not low birth weight at all his fingers and toes. And he is just precious. And yeah, so we're very grateful that after all that, he was here. So I stopped chemotherapy about 3 weeks
Mhm.
before giving birth, to give my body some time to, there was a risk of bleeding or infection if I had continued on with chemo, just because that lowers your ability to, recover from things like that. So I had a 3-week break, had a baby. And so, yeah, so then I was sort of in that newborn bliss. I just remember I didn't want to leave the hospital because it was like, baby was fine. And we took this huge breath. We praise God that we had this healthy baby boy. And then the nurses are like, okay, it's time to go home. And I'm thinking, I don't want to go back to cancer world. Let
I'm
me just stay in
done.
this little newborn cocoon.
Yes, yes, absolutely. So tell me a little bit about breastfeeding. Like how is some people maybe learning like, well, now you're going through these chemotherapy treatments. There was no break in at that point, right? You're still in chemotherapy at that point.
So about 3 weeks before birth, I stopped. I'd had my last chemotherapy.
Okay, okay.
So that I had 10 total chemo sessions, and my oncologist advised that 3 weeks would be long enough to for my body to have gotten rid of all of the chemo, and so I would be able to breastfeed. But she did say, because of having gone through chemo recently, your milk production might not be where it would have been otherwise. And so I was sort of prepared for that. But we had a conversation with my oncologist. I had a conversation with my OB and the high risk doctor to kind of, because I didn't know if it was even going to be an option.
Okay.
But they said, yes, you can try on your unaffected side. So my cancer was on my left side. And they said, try on your right side. And so I did. I was able to breastfeed for about 2 weeks. To be honest, the production wasn't
Enough.
probably like it would have been otherwise. But it allowed me to, bond with my baby just in that immediate newborn time. I'm so grateful for that, just for the opportunity to try. And then 2 weeks after giving birth, I needed to do a PET scan. We needed to go back and see if the cancer had spread or what we were dealing with since birth. So at that point, I stopped breastfeeding. I wouldn't have been able to.
Because of
Um,
it. Yeah.
Yes, because of the PET scan. So we thought, you know what, this is just going to be a good time to stop. We'll do the 2 weeks and then we'll move on. So
Okay.
that's what we did.
And I think that's exactly when I met you. So you came for your pre-op. And you were in that stage. I was like, oh my God, how are you doing? Like, yes, I'm concerned about this possible lymphedema, whatever is going to happen with you. But at that point was more like how mentally and physically you just deliver a baby. You just went through chemo during pregnancy. Like, I was never been more concerned from anybody else. Like, how in the world, like I treat a lot of women coming pre-op, prior not to surgery for breast cancer. And I was like, holy cow, how are you doing? Like you and your husband just dealing with all this. And I remember at that point we were talking about the help that you guys were planning to have with the other kids and all those kind of things to try to go through a mastectomy. So you want to take us back again? How was the preparation into going into the mastectomy?
Really crazy. So about 6 weeks after giving birth, I had surgery. But in that 6 weeks, it wasn't like the normal postpartum recovery. I had to get up. I had to go to testing. I had to go meet with doctors. And, thankfully, we are extremely blessed that my parents live close. My husband's parents live here. We have a great support system here in town. So I had to leave my baby with someone else and go, meet with doctors and do testing and drive to Shands to see if that was going to be an option for me, which it was, thankfully. And so all of that had to happen. So I almost didn't really have a choice. It was like I knew that I needed treatment. This is what I needed in order to have the best chance of survival. And so I had to do it. I had to get up. I had to move. I had just had a C-section, but I had to get going because I had to do this for my family.
Mm-hmm.
And
That's
so yeah, I just kind of, and I, at some point there were moments where the gravity of it just would smack me in the face. Like all of this is what you're going through. But I would just, I leaned on my faith, my family, my husband, my children, just looking at them in the face. It was like they needed me. So I had to do what I had to do to take care of it. So the postpartum was just a whirlwind. That 6 weeks was just crazy between, newborn stuff and having two other children,
Mhm.
back and forth to doctor's appointments and setting out a plan for surgery. But once we had that plan, I remember my husband and we decided to go to Shands to have surgery. That was going to be the best option.
Uh-huh.
I'd been receiving chemo and therapies here in Tallahassee at our cancer center, which was wonderful. Um, so when we went down to Shands to for the procedure, it was like a little mini vacation.
Vacation. I
Yeah.
remember when you guys were here by yourself. It's like, oh wow. I think I met you like the day before surgery, right? I think that you guys
Yes.
were going that night. I was like, well, you go and have a good dinner if you
Yeah.
can.
Yes.
To take a breather from all the kids and all the, no sleepless nights. Trying
Yeah.
to do that. Yeah, yeah, I remember that. I remember that. So you already kind of mentioned all the support, but what was the biggest source of support during this journey?
Goodness, I can't. I don't even know where to start with this question. I mean, my husband has just stepped up big time, and there were times where he would say, what do you need? And I would just look at him and I couldn't even articulate any words. Like I don't know what I need. But he would just jump in,
Uh-huh.
and we really worked together as a team to handle our home and our family and the kids and everything that they needed. We didn't want them to really feel the impacts of what was going on. We try to make things as normal as possible. My parents taking care of my kids while my husband would work. They were a huge support. My in-laws were a great help. My brother and my sister-in-law is a nurse, and she shared so much valuable information with me. Um, and then I have this core group of girlfriends, my very, very best friends from high school and my very, very best friends from college. And they dropped everything to help me, to drive into town, to sit through chemo with me, to rearrange my boy's room so
Ah,
we could
I
put the
know.
crib. They just helped so much, and they were my cheerleaders, and sending me text messages and calling, and I just can't even articulate. I don't know what I would have done without the support that we had. And I think that, one of the questions later on is, what would you tell other people? One thing is, you've got to have
The
a
support.
support system.
Yeah.
You've got to find those people to help you because you need it. And you need people who will just step in even when you don't know what you need,
Yes.
because there's going to be times where it's so overwhelming that you just don't know. I need something, but I don't know what it is. And so having those people who just step in and say, I'm going to do this for you, has been incredible.
You mentioned something really that I hear someone talking once before from another podcast talking about how sometimes we offer, right? When somebody is no is dealing with this amount of stress, we offer like, what can I do for you? But like you say, right now you ask me, I don't know. I really don't know. Versus maybe for people out there who is trying to support other people going through rough times, not necessarily cancer, but any rough time, maybe instead of what can I do for you, like I'm gonna do this and I'm gonna send you this gift card, or I'm gonna just go ahead and spend the day with the kids so you take a break, or whatever it is, right?
Right.
Just go ahead and jump and do it versus asking, because as a human beings, if we get asked, we don't feel comfortable telling you what we need, right? Instead
Right.
of just do it, just jump in and
Yes.
say, hey, I'm driving, I'm bringing dinner tonight, don't cook anything, or
Right.
I'm sending a food, or whatever it is, or
Yeah.
I'm just, having all these things for the new baby, so you don't have to worry about buying stuff. We take
Right.
anything like that. So I think
Yes.
it's good learning from people that surround us that is going through rough times. Again, not necessarily cancer, but sometimes it's a better way to just do it versus asking kind of situation. So that's
Yeah.
good to see it in practice.
One of my friends, she sent me a message and said, here's three options I can do for you. Tell me which one would be the most helpful. And I loved that because that allowed me to kind of,
Ah,
tell her,
yeah.
okay, yeah, this would be great.
Yeah,
So I appreciate that.
that's awesome. So do you have any time because everything happens so fast? Any guidance from any other support groups or other mothers who went through similar experience? Did you get an opportunity to look into that?
I did, yes. And right off the bat, that was the first thing I started doing was reaching out. I'm generally kind of a private person, so a lot of my life is not on social media, but I found some great support there. I found that just talking to other people, at first, I didn't want to share what was going on. It was kind of hard. I was trying to process it. I was scared out of my
Yeah.
mind, and a lot of questions that people would ask, I didn't know the answers to. But I found that the more that I shared what was going on with me, people would connect me with other people and say, I know this person who went through this. Let me give you their phone number and you can talk to them. I know this person who went through this. And I connected with this woman who was a huge support for me. She actually worked at the cancer center. She had breast cancer
Wow.
when she was pregnant with her third child. We were almost along this exact same track. And that was 18 years ago. And so
Wow.
she was a huge source of support for me. Just watching her, hearing about her story and her family, that was very inspirational to me. And I appreciated that a lot. There are other organizations. There's a organization called Hope for Two,
Oh,
which was really helpful to that I found. And it's not just breast cancer; it's any cancer, pregnancy, women who are pregnant and have cancer. There's also a Facebook group I joined that was called Pregnant with Cancer Facebook group.
okay.
I found so much um, sources of information and help there. Again, that was not just breast cancer, but other cancers. But women would share. My favorite thing was they would share pictures of their chemo babies.
Oh,
This is my baby, 9 months, 5 years, 18 years later. And so to see other people having gone through this and survived and their babies are healthy, that was huge. And so that gave me a whole lot of hope. Um, and another thing I did that was I started a prayer journal. And so just journaling my thoughts and feelings that helped me a lot. Um, I wrote letters in my journal. And so that was a huge
that's
source of
great.
support. And my church family. And I really believe that having a faith and a foundation there was really what kept me on track throughout this whole last year.
Yeah, absolutely. And talking about journalism, this is such a big thing that, sometimes people is not aware of and is really powerful, like really just dealing with any kind of stress, like dealing with a cancer diagnosis, but anything mental health that is very stressful and really, is a great avenue for your mental health. So definitely
Yes.
getting all these cortisol levels down. So definitely that's a really good tool to use on a regular basis. Even now,
Right.
even just on a regular crazy career life and dealing with three kids, right? So
Yep.
still like, very applicable when you have crazy days like today, right? So that usually works really well. That's great. So in your any lasting effects from treatment is still navigating today with you?
Yeah. So unfortunately, I do have some neuropathy, which is one of the side effects of the Taxol chemotherapy. Um, and throughout that, receiving that chemo, I would ice my hands and feet to try to prevent it. So I do have a little bit. And then I'm still working with you and my PT team here in Tallahassee to get the full range of motion back with my arm after having a lymph node removal and the lymphovenous bypass surgery. That's been quite a journey of healing there, um, regaining strength in that arm. I don't think I was truly prepared for how much that would take. And having, prior to pregnancy, I was working out really regularly. And so now I'm like relearning how to do a push up.
Uh-huh. But look at you
You
now
know,
doing a push-up. That's awesome.
yeah. So yeah, still working through that. I did cold capping, so to mitigate, hair loss throughout chemotherapy. That actually worked really well for me. So I maintained probably, like, I wouldn't want to say like 50% of my hair. So that is, a side effect. I'm still dealing with the regrowth there. But those are the big side effects. And then now, having gone through that treatment, I'm on hormonal therapy treatment, which is a whole new set of side effects.
Yes.
And being in a medical menopause with the hot flashes and the brain fog and more hair loss and mood swings. So all of that, dealing with it. But I think overall, some effects of chemotherapy can show up later down the road. So I'm not quite sure what is coming, but at the moment, it's all manageable side effects.
Okay, very good. Excellent. And we can chat more about those hormones when I see you again. So I have a
Yes.
lot of good information for you. Uh, how did it change how you advocate for your own health and wellness? This just going through this journey?
Um, I have a lot of respect for folks in the medical community, doctors, nurses. There's so much out there, and I think that this has caused me to ask more questions, and um in not in a way to challenge, but in more of a way to understand, help me understand why this is happening, or what's going on. I I tell all of my girlfriends, if you ever find a lump or if you ever feel something, you get a biopsy right away if someone tells you that it's nothing, and you have that gut feeling that it's something, because that's something that I wish I had known, that I should have asked for that.
Mhm.
I try not to dwell too much in that space, because if I had, I wouldn't have probably would have gotten pregnant and wouldn't have my baby. So all things, happen for God's plan and purpose. But that is one thing that I would ask for. But asking questions of your medical team, and then now I always end every appointment I have with, "Is there anything I should have asked you that I didn't?" Because sometimes there might be something that I didn't know to ask. Right? You don't know what you don't know. And so trying to navigate what questions to ask can be a little bit tricky, especially with something like cancer, when there's all these terms and stuff that most people are not familiar with unless you're in it.
Mhm.
The other thing I've learned a lot through this is communication across multiple treatment teams. So having gone through oncology, having an oncologist, and then having a surgeon, and then having a radiation oncologist, you have all these people who we would like to think that they talk to each other. And I think for the most part they do. But then there's some things that, may not be communicated. And so I have found that I will go into appointments with my doctors and just, let me update you on what happened at my last appointment with this other medical professional, so that we're all on the same page, instead of assuming that they've had time to read the notes or something from a previous follow up. So I think a quick recap from, in those meetings, let me tell you what's been going on,
Yeah.
instead of assuming that they already know. I feel like that's been helpful
Yes.
since having this diagnosis.
And that's a very good point, mainly in your case, because you have two different places doing your treatment. So you were in Tallahassee for one thing, and here you have in surgery. So when you're in the same place, it's easy because then everything goes through Epic, and then we can see everybody notes. Versus when you're somewhere else, sometimes they send it and things get placed on media tab, but sometimes there's a delay on that, and then sometimes that doesn't happen.
Mhm.
So you were really good about being your own, like you took that really well, that you were able to come here and you gave me a report. This is what's happening, then this is happening, and now this is happening, and this is what's gonna happen. So that's really helpful. And again, takes a lot on the patient to learn all that and to be organized, to be able to understand, to explain what's going on. Sometimes patients have absolutely no idea what's happening. and they're like, I don't know how many lymph nodes they took. They do this chemo. I don't know how long. I don't know how long radiation, and it's hard. And it's hard. But again, part of it is you're young. How is level of education is like the support. So that all that together is such a helpful thing for people out there who is even in the same system. Sometimes, we still be able to look at the nose, but sometimes nose are not clear. So really, you're your own advocate. So really, you're gonna get out of it whatever you put into it. So
Right.
that's a very good point. Um, do you wish more people understood about being diagnosed with cancer during pregnancy?
Yeah, so I didn't even know that that could happen. And maybe that, that's sort of naive of me to say, but um I I hadn't known anyone who had been pregnant and had cancer. I knew people who had cancer after they were pregnant, but not during. So, each case is unique and you have to take a lot of things into consideration. Um, you know, I I think probably the biggest thing I would say would be that for people to know that treatment is available for women who have cancer and are pregnant. Um, being in some of these groups that I've joined online and seeing what other women are asking questions or posting things, and some of them talk about delaying treatment because of being pregnant. And again, everyone's story is different, everyone's diagnosis is different, but um, I would wonder if they had those questions have been really discussed with their oncology team to know that there is an option out there, or there may be an option out there for you to help you. Like I said, with me, we were buying time until I could have the baby before we could really hit the hard treatment, and I think that made a huge difference. So just knowing that it's an option that yes, like we talked about, yes, you can have chemotherapy while you're pregnant in some cases, and maybe that is a case for someone who might be in that boat, to ask those questions and say what is available for me, and even sort of going back to advocating for yourself. If I don't do this, what would happen, or what are the possible results or scenarios if I do not do this thing, if I do not have this treatment or that treatment, or are there other options available? So yeah, that's what I would say.
That's perfect. And I think that kind of goes along with my next question, that what message will you give to other women who might be facing a similar diagnosis?
Yeah, I would say, this is going to be tough. This is a big battle. Cancer alone is a huge thing to face. Being pregnant and having cancer is a whole other ballgame. There's a whole nother person that we're thinking of here. It's your health and it's the baby's health. And so I would, just say, have honest conversations with your medical team, surround yourself with a team that you trust, so that when you ask those questions and you get information, you can trust what they're saying. Don't be afraid to switch providers if you are unsure of something that someone's telling you, even if it's just for a second opinion or even a third opinion. I got several other opinions. I switched my maternal fetal medicine doctor. I switched that at one point, because I needed a different level of care. And so you have to do what you need to do to make sure that you are making the best decisions for yourself and your family and for your baby. So that's what I would say to someone else, and also to just have hope. There's a lot of um, a lot of thoughts that come with a cancer diagnosis that are I call them invasive thoughts. It's those weeds that grow in your mind and you start thinking about, um, the negative, which is, of course, a realistic
Mhm.
thing that you need to face and you need to think about. But I would give myself time to have those thoughts and to think, and when I'm saying that, I'm saying, there were times where I was like planning my funeral. What
Mhm.
is going to happen to my children?
Mm-hmm.
to my husband when I'm gone.
Mm-hmm.
It's just a reality of the thoughts that come into your mind.
Yeah.
And I think you have to sort of face that and then say, uh, not today,
Yeah.
you know, not today. I am,
Yeah, it's good to have a plan for like 50 years from now.
yes, today this is not happening. And then and tackle it in small pieces. What do I need to do today?
Uh-huh.
And let's do that. And then tomorrow or wake up, it's a new day. What do we need to do tomorrow? We'll face that tomorrow. But it's very scary going through cancer diagnosis and going through it pregnant as well, because you're afraid for yourself, you're afraid for your child.
Absolutely.
But
Yeah, absolutely. Yeah, definitely adding a different and a whole other stress, but at the same time, in the worst case scenario, is like a motivation, right? You're not giving up because if you're giving up, you're giving up on the baby.
right,
So it's like that just bring another completely, it's like it's not about my life anymore. It's about his
yeah,
life, right? Or her life or the baby life.
yes,
So
yes,
definitely it's a different perspective, right? It's not so much I can't
yes,
just be here and feeling sorry for myself because
right,
somebody else who I need to pay attention and somebody else who needs to survive this. So I think that
absolutely,
kind of like make a little difference because no, it's a resilient, right? That's what we do, moms, right? So it's all about the babies. It's all about the kids, right?
yes,
So no matter how you felt, you have a C-section. I had two C-sections, and I remember the recovery was no easy, but when you have somebody who needs you and somebody who is there in the clinic or in the ICU and you're like, or the NICU and you're like, I'm not leaving my baby either. I'm going to stay here and no matter the pain I have on my belly every time I try to get up, doesn't really matter. The most important thing is I'm with the baby and the baby is okay. And
yes,
that just like, or even remember like how much pain I had on my belly until I have my second baby, he was fine. And then like a C-section, I'm like, oh my God, this actually hurt. I don't remember any of it for the first one
yeah,
because I was more concerned about something else with the
yeah,
first one, right? So definitely put a different perspective. Again, it's not making it less stressful, but it's different, right?
yes. It's a huge motivator, like
Ah,
exactly like you said. It's not just for me, it's for the
yeah,
baby too.
yeah,
Yes, definitely a huge motivator. And also I would say it can be a good distraction too when you're going through all of that. There's a part of me that was angry for a long time because I thought that, here's a surprise third pregnancy that I should be just overjoyed about. And I'm so sad because I'm afraid. And I had to just check myself and say, you know what, we're going to find the joy in this situation. And yes, we have to go through cancer, but we're going to go through it. And me and this baby together, I was never alone in,
uh-huh.
in that chemo chair because he was always with me. We were
Ex-
always there and he was kicking the whole time. And so just finding those moments of happiness and joy and knowing that yes, there even in the valleys, there's light. You
Yeah.
just have to find it.
Absolutely. It's funny how, and you tell me this, I have somebody else who was pregnant, and then she keeps saying that definitely, she called it her baby's baby girl, a chemo baby, because she's like wild. She's like, oh my God, if I compare my oldest son with her, I have absolutely 100% that chemo has some kind of effect on her. She's totally healthy, totally fine, but she's like the wild baby. Have you noticed if your baby, if you compare with the other two, is in that similar or he's more quiet?
My gosh, he's 9 months now. He's crawling, he's pulling up on stuff. He's really starting to show his personality. He seems to be a little bit of a daredevil because he will just like let go and like he's just gonna free fall. He is so observant, watching everything that everyone's doing. And I can't wait till he starts talking to know what's going on in his little brain. I do get this feeling that he's going to be a little bit of the wild child,
Yeah.
and
Yeah.
yeah, and so that'll probably be the chemo
Yeah.
baby with the wild streak.
Yeah, I wonder, this is something to leave to the docs for research, right? What's happening really intrauterus on their little brains when they get like, do they just really like, I don't know, but
Yes,
definitely something very special about them.
yes,
Maybe a good conversation with your face group moms there.
yes.
The ones that have been growing up already, right? Um, Looking back, what has surprised you most about your strength on your journey?
I think, oh, I've just been surprised by sometimes it's, people, I'll be talking to them about, what's going on or my story, or they'll hear just little pieces of it and say, wow, gosh, how did you do that? And I don't really know, to be honest. And there's probably lots of therapy in my future. But it has just surprised me how resilient women are, how much your body can recover after going through something. Birth is a lot,
Yeah,
um, regardless of anything else. And then having, going into birth, having just come off of chemotherapy, and then 6 weeks after birth, having a mastectomy and the lymph node removal. And then, then I went into radiation
yeah,
right at 4 weeks after that. I'm in radiation for, 30 rounds. And so that's a whole new set of challenges there. So I think our bodies are super resilient. I think I've just been surprised by that. I've also been surprised by um, the fact that a lot of healthy people get cancer.
hmm. You were
I think
healthy?
that's
Yeah,
maybe a little bit of a misunderstanding. It certainly was for me. I thought, I eat well 80% of the time. I work out regularly 3 to 4 times a week. I'm doing all the things that I'm supposed to do to prevent cancer, but yet I still got it. So I think that knowing your body and knowing enough to be able to say something's not quite right. I need to stop the rat race of work and kids and this and that and go spend some time to take care of myself and to figure out what's going on. I think that's another huge, that's going a little bit off the track from your original question, but that's huge. That was sort of a surprise to me. I wasn't really aware of the rate that cancer would affect people who I would have considered, healthy, following the quote unquote rules of what you're supposed to do to keep
yeah.
your body healthy. But yeah, gosh, women's bodies are just incredible, and I'm just in awe of that.
Yeah, absolutely. But I think part of what you mentioned, because we are getting a little bit more worried about now, or I hear, a lot, actually, couple of physicians used to work with, they decide to just kind of stop like being like, traditional radiation oncology and then just moving into the wellness, more functional medicine, wellness medicine, because they just kind of start getting tired to see more young people developing breast cancer or any other cancers, right? And so it's kind of get to the point that they're like, I'm done treating something. Why we don't start fixing the cause of this instead? So what we need to fix in our environment and our own health from, you say already, right? Being more physical active, have a better nutrition. But besides that, because that's what you've been doing all along, what about all these outside things that happen? And what about our body and mind, right? So the mind is amazing. And we're thinking we are super healthy and we eat well and we're active and we manage all these stressors, but that's exactly what's happening, right? Those stressors and that cortisol up there is a huge impact in that inflammatory cells and all these
Right.
other things. And then all the environment, unfortunately, right? We have all these toxins around us from process, from, plastics, from all this environment that unfortunately, the more people can hear about it and try to make little changes, hopefully that'll help. Because, people just thinking, well, I'm doing the two things I know what to do, which is, exercise and try to eat as healthy as I can. And
Mhm.
besides that, there's nothing else I can do, but there's some other things out there, like you say, control stress, like take a moment and take care of yourself. Like, when do you do some, meditation? When do you go do journaling? When do you go read a nice book? When do you just say, that's it, I'm done, kids,
Right.
I'm done, this is my moment. And I'm just gonna go for a walk, or I'm just gonna go to the spa, or I'm just gonna go get a massage, or I'm just gonna go to have lunch with my friends and just chat. anything like that, because sometimes as a mom of three kids, it's like you just don't have time.
Right.
And everything just goes up, 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 up until somewhere has to be breaking until boom, this happens. So
Right.
yeah, hopefully
I
we
think it doesn't even have to be this big, you don't have to go to like an hour and a half hot yoga class.
yeah,
You could take a 5-minute walk to the mailbox
yeah,
and take some deep breaths along the way.
we got it.
It can be these little things throughout the day. I think for a while I thought that, like, okay, it had to be this big production thing, self-care, taking care of myself, going to get a facial or something. It doesn't have to be that.
No,
It can be simple as just walking outside. I'm stand on the front porch for 3 minutes
we
and I'm
got
just going to breathe.
it. Yeah.
And then I'm going to go back inside and finish whatever I'm doing. It
Yeah.
can, it can be as simple as that.
Yeah, go smell the flowers outside in your backyard. Get the sun hitting you for a second or so.
Mhm.
Get extra vitamin D, anything on those lines. Absolutely. That's very helpful. So if your child listens to this one day, what will you want them to know about this time in your life?
Oh my gosh.
This is the wrap-up question.
This is a question I've been thinking about for a week and I just cry every time.
Uh-huh.
I just, I want him to know that he is precious, that his life has meaning and purpose, and for him to exist after all of the challenges that we face, to the surprise pregnancy and the going through cancer, for him to just even be here is a complete miracle. And I hope he always knows that, how special he is, how wanted he is, how loved he is, and how much he, just by being there, has helped me, give me strength. um I would just hope that he would have a relationship with God where he understands how valued he is as a human being, as a person, because just his existence is incredible, is a miracle, really. um and I hope all my children
Yeah,
know that for
yeah,
sure, and that throughout this time, I hope that they are young enough to where this won't have affected them as much as it might have had they been a little bit older.
uh-huh,
I know that it will impact their life for sure, because there's more treatment down the road.
uh-huh.
um I will always be battling cancer for the rest of my life, and so it will be a conversation in our house. But
Yeah,
I just hope that they look back and see a mom who was tired but who played,
uh-huh,
was exhausted, but we went to the park
uh-huh.
anyway, and that they know that I would do anything for them.
Absolutely, absolutely. That's very sweet. And again, and think about, you were talking a little bit about, like, do they have any trauma from this, right? Because they're still young, but it is a lot of, and we can talk a little bit more about this. And I can send you some resources in regarding, books for kids to kind of talk about this condition. Sometimes we have patients who have kids that are a little bit older, right? And they understand what's happening. And sometimes you can either go the two directions, just try to don't tell them anything and don't let you see what your body looks now, or you can totally face it. But then as you face it, which I think is the better thing to do, is you just have to tell them, right? This is kind of like the new changes that is happening mainly when your daughter, or no, is going being more like a teenager, right? Like what's difference, which at that point you should be able to kind of get back a little bit more to how it was before. But still, it's not a bad thing to kind of really say, yeah, this is what we're going through. And this is, I
Right.
remember when I met you, I was worried about your 3-year-old, right?
Yep.
Because I was like, man, we gotta be teaching him like not to kick mommy, and you gotta be careful because he's a roughy one, and you're
Yep.
gonna have a mastectomy, and how can we start to prepare them for this, right? Like, Don't jump to mommy because I have a boo-boo there on my chest. So you gotta be careful with that. And they know, even if he was 3 years old, I'm sure he knew. But if we don't prepare them ahead of the game, how can they be more careful, right?
Right.
Uh, and then they know when something is not right, and they're very smart and they perceive that. But I think when you talk to them, but then again, it's some other like books and things later on as well, and even now, that if you're gonna be, they're gonna hear the word cancer, which I'm sure they already have many times. It's like, okay, what is all this about? Is this a scary word or not? Because that's what they're gonna hear in the school, right? They're gonna start listening to this word like, oh, wait a minute, mom had cancer, so that means that she's gonna die tomorrow because this is what we thought was happening, right? This is the first thing that comes to your mind, even though we know how well breast cancer, as when it's being treated on time, has such a great, outcome. At the end of the day, yes, it's gonna be a worrisome for you from now on, but that doesn't mean that it's gonna have to deviate the happiness of your life either, right? So again, there's so many other things out there with books and psychology and therapy and things like that, that it is not a bad idea to
Yeah.
expose the kids to before they actually start having issues, right? So
Right.
that's not a bad idea. So
Yeah. We've
that's
been,
been wonderful. You have made me tear up again. Again, I'm super emotional too. So I was like, oh my God, this is gonna be very emotional. But I super appreciate you doing this. I know we're still like early in the journey in a way, even though she's
yes.
already 9 months. It's like, this is already been over a year of treatment, but you're amazing. And that's why I felt like, oh my God, she's just going to bring such a great story to other people and it's going to help out if somebody else is going through this. So I really appreciate you doing this with me.
Thank you for inviting me. And, one of the things that's sort of given me hope through this is looking at the other people who have helped me and thinking maybe one day I could share my story and help someone else. And if that's the case, then, I'm happy to do that. So thank you for allowing me to share with you today.
Absolutely. We need to bring that little boy when he start talking for second chapter, the second
Yes.
episode from Erin and the baby. So thank you again. You have a great evening. Go and enjoy these little guys.
Thank you.
Okay, have a great evening.
Thanks.
Bye.
Bye.